listening to Not Crazy, a Psych Central podcast, hosted by my ex-husband who has bipolar disorder. Together, we created the mental health podcast for people who hate mental health podcasts. Hey everyone, and welcome to this week's episode of the Not Crazy podcast. I'm your host, Lisa Kiner, and with me, as always, is Gabe Howard.
Hey everyone! Today's quote is, "You don't have to struggle in silence. You can be unsilent," said by my soon-to-be fourth wife, Demi Lovato.
Nobody is going to get that joke.
Well, first and foremost, I think that I have reached a level of popularity where everybody will get that joke, as I have talked about Ms. Lovato in the past. But for those who don't know, I am on my third wife, and apparently people don't like to be married to me. So I have found replacement wives just in case the worst happens, and Demi Lovato is 4.
Whenever we're out in public and Gabe sees an attractive woman, he'll look at her and go, ooh, 4.
Yeah, no, 5. Demi Lovato is 4. The funniest thing that ever happened, of course, is we were watching television. I think like Magic Mike came on or something. And my wife was sitting next to me and she just like slowly lifted her hand and her finger and pointed at, the half naked gyrating man, looked at me and said, 2. We still laugh hysterically to this day. Lisa, the reason that we have flipped everything and just done it all wrong is not because we're losing our minds. It's because today we are going to interview you. That's right. Lisa Kiner is going to be the focus of the show, and Gabe Howard is going to take a much-deserved back seat. Lisa, are you ready for your first question?
It feels like opposite day. Yes, I'm ready. Absolutely, Gabe. And see, people will get that that's a joke because we've reached a level of popularity where they'll understand it, right?
I didn't even get the joke.
Because I said absolutely.
We cut those out, so I don't think people know that that's your verbal tick.
It was in an outtake. I think they've listened to all the outtakes and memorized them.
Lisa, so we know that I live with bipolar disorder and anxiety, and we talk about my mental health a lot, and we talk about all of the ways that you have helped me with my mental health, and we know that you live with depression because you've mentioned it before, but we've never really done a deep dive into, well, frankly, your mental health, your life living with depression.
Right.
For the listeners, what is your official mental health diagnosis?
Depression.
Any particular type of depression? Is it like seasonal depression, major depression? Is it
major depression? See, I don't have as cool of a diagnosis as you because you get like extra things to go with it. I just have the one. It's plain.
This is not the suffering Olympics. It's not plain. It's serious to you. And major depressive disorder is a real big deal, right? I mean,
yeah.
People die from it. It's interesting to hear you as a mental health advocate talk about it. Well, it's not as serious as bipolar disorder.
I did not say that. I did not say it was not as serious. I said it's just one word. It's not like bipolar disorder with psychotic features and anxiety, which is many words. It's just one word. It has nothing to do with seriousness.
You could go with major depressive disorder. That's 3 words.
I could. I will remember the extra words for the future if I need more words.
As you know, my pet peeve in the whole wide world is people who are like, yes, I have bipolar disorder with mania, hypersexuality, depression, anxiety. You're just describing bipolar disorder. It's like, I have the flu with a runny nose and a cough and a headache and a sore throat and I'm tired. That's the flu. You just describe it. Just say the flu. Wait, yeah. So back to Lisa. Lisa, when were you diagnosed?
Officially my sophomore year in college, but I clearly had depression for much, much longer than that.
When I tell my story, I always say I showed the signs of bipolar disorder way back into my early teens, but nobody noticed because nobody really had any training. Now, in your family, your mom was a psychiatric nurse. Your parents are very well educated. Did they not see the symptoms? Like, what made you need till...
I think that's actually what got me, is my mother was a psychiatric nurse. At the time, she worked in the only private psychiatric hospital in Ohio that accepted children. And so these kids, they were so sick. The absolute worst cases you could imagine ended up there. And so now she had this kid at home who had depression. Yeah, but she was fine. It was not like I was as sick as these kids.
I think it's always important to remember that just because you're a doctor, a psychologist, a psychiatrist, a psychiatric nurse, you're not those things to your family and your children and your friends, right? Your mom has mom hat at home. She's not trying to follow you around and see if you have a psychiatric diagnosis. I think it's important to say, right? Because it's really easy to say, oh, well, your mom missed it. How could she? But that's not reality.
Well, it's also, things were different then for both of us. People did not diagnose teenagers with bipolar disorder when we were teenagers.
Did they diagnose kids with depression? Did they?
Not like now.
Because you were also suicidal. One of the things that worried me looking back and frankly frightened my parents to this day is the fact that their son was suicidal, teetering on the edge of life and death, and they didn't even notice.
Yeah.
Does your family feel the same way when they realized that, hey, as a teenager, their daughter was suicidal in their own home?
I don't know. We've never discussed it. That might be a fun conversation for the holidays.
Do you think that's typical that families don't discuss it?
Well, and again, I've always felt bad for parents of teenagers with mental illness. How do you know? Oh, my teenager is moody and difficult. Yeah, no kidding.
No kidding.
How can you ever possibly tease that out? Or things like, oh, my kid doesn't want to leave their room. They're afraid of social situations. Where's the line? So I've always had a lot of sympathy for parents on that.
I think it's really important to understand that all of the misinformation that is out there for people with mental illness, it's also out there for their family and friends. And while it does add an extra wrinkle that your mother is in the medical community or that your father is a teacher, I really think it's important that people understand that this does not shield you or shelter you from these things.
Right.
Just because your family has more knowledge doesn't mean that they have enough to recognize it. That makes this really scary, right?
You also have to consider, what were the options back then? When did Prozac come on the market? It's not like you had all these options for treatment.
You make a good point. Prozac came out in 1987, so you would have been 11. So Prozac was out, but it was new. And
well, it wasn't widely prescribed and certainly not for kids.
Yeah, I don't think it was prescribed for children at all. And there was a lot of misinformation about it. The early reviews for Prozac from a public relations standpoint were not good.
Well, you remember Prozac Nation.
Yeah, they did a really good job of explaining why if you're, sick and need help, you shouldn't take it.
Yeah.
It was propaganda and scary propaganda. And yet I know, Lisa, that you to this day were like, well, yes, they were wrong and it was scary propaganda, but they make some good points.
I do think they make some good points. I believe there's an episode about that, but mental illness, especially mental illness in kids, was not thought of the same way as it is now back then.
What symptoms did you have exactly? What was happening to little Lisa Kiner in Mansfield, Ohio back in 1990?
Well, by 1990, I would have been
14.
I would have been 14.
Yeah.
I don't remember a time when I wasn't depressed. I can actively remember being very depressed in elementary school. And I have spoken to doctors as an adult who have told me that children that young can't have that level of depression. It doesn't work that way. But that is the way I remember it. I feel like I always had depression and I was actively suicidal my entire time I was in high school.
But what did that look like? What would I have seen if I were Santa Claus in 1990 when I see you when you're sleeping and I know if you've been bad or good?
I don't know that anybody else would have seen anything because I hid it. But what I saw is that I had this level of depression and sadness and hopelessness and thinking about death and planning ways to kill myself every single day. Every day, all the time, always. I always found it very comforting.
Did you actually have a plan, or was it just more of a nebulous, okay, I could die and I don't think I'd care?
I had multiple plans. Whenever I got really depressed, whenever I felt really sad, I would come up with a way to kill myself, if possible, on the spot. It was comforting. Looking back on it, I realized it was a control thing. I was thinking to myself, look, I'm in control. This is really bad, but I can make it end if I really have to. And this is what I would do. But at the time, I didn't see it that way. When I was like daydreaming in class or whatever, I was coming up with ways to die by suicide.
Did you ever get close to enacting any of those plans?
Not until after I started taking antidepressants, strangely.
Let's put a pin in that just for a moment and talk about how you finally got diagnosed when you were a sophomore in college. Now, people don't know, but you went away to school, so you were now...
in the dorms.
Yeah, you were 150 miles away from your family, living in the dorms. What made you get help?
I had finally gotten so bad that it was affecting my grades. I think that's one of the reasons no one ever thought it was a problem as I was a teenager in high school, because I always got straight A's. And especially for teenagers, people take grades as a proxy for everything. A kid can't possibly be having emotional problems or trouble at home, or there just can't be anything wrong with a kid who gets good grades. And my grades were perfect. Therefore, there must not have been anything wrong with me. So as a sophomore in college, I just couldn't do it anymore. I had stopped going to class. I was failing out of everything, staying in the dorms and sleeping all day. And truthfully, I'm not even sure what made my parents even notice. Like you said, I was far away. Another question I will have to ask over the holidays.
Well, now wait a minute. Time out. So your parents noticed. Your parents got you help when you were a sophomore in college. This isn't something...
Yeah, they came to my dorm room. They drove to Columbus to my dorm room to rescue me.
And how did they rescue you? What did that look like?
They made a doctor's appointment for me with a psychiatrist.
Okay, so now you went to the doctor, you went to the psychiatrist, you were diagnosed with major depressive disorder, you were put on... Antidepressants for the first time. So now you're getting psychiatric care for the first time in your life when you were a sophomore in college. So you would have been about, 20 years old at this point?
19.
18, 19. And then you said that after that treatment, after meeting with the psychiatrist, after being put on antidepressants, the suicidality didn't stop or it got worse because you said that that's when there was a plan.
Things got much better. Things got much better for over a year. It was amazing. Antidepressants worked very rapidly. They worked very well. And it was creepy because now my private thoughts had changed. Nothing is more innately you than what it is you think about when you're alone. And that had changed, and it was creeping me out. And kids that age have existential angst anyway, right? Where do I end and mental illness begins? And here I am taking these pills, and I read Prozac Nation. What am I doing to my personality? Am I just medicating myself away? And what's the moral implications of this? Blah, 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 blah. And I just went on and on like that around in my head over and over and over and over again. And of course, there's a lot of mental illness in my family, acknowledged mental illness. All growing up, we all knew that so-and-so had this disorder and so-and-so had had a breakdown and this family member had been to the mental hospital and just on and on. I happen to know that I had been prescribed the exact same drug at the same dosage as a relative who had had lots and lots of problems with mental illness and had been hospitalized multiple times. Well, she was crazy. I wasn't as crazy as her, obviously. The idea that I would take the same drug was ridiculous. So I started cutting the pills in half. Because she was way nuttier than me. And there was some sort of moral value to that. I didn't need it as much as she did, so I could take less.
But just to be clear, I'm not trying to interrupt you here, but just to be clear, you did not follow your doctor's orders. You changed your prescription on the fly without consulting your psychiatrist, and you had a bad outcome.
Yeah, go figure. Who saw that coming?
Yeah, and the bad outcome was?
I became much more actively suicidal and started gathering a suicide plan.
What happened then?
Well, when you're actively suicidal, you're not thinking straight. So I had decided that there was all this stuff I needed to do before I could die. And I did all sorts of foolish things that would never have mattered if I was dead. I picked up my dry cleaning. Like anyone would care about my dry cleaning if I were dead. I returned my library books. I cleaned my apartment. I balanced my checkbook. Well, all this stuff took a really long time. It took me like a day and a half to do all of this stuff. At first, I was hurrying up. Okay, let's get this done. Let's get this done so I can get to the good thing. Let's get this done so I can go ahead and kill myself, which is the goal. But after a while, I realized, I'm not hurrying up to get it done anymore. I'm procrastinating. I'm stalling. I'm coming up with more stuff to do so that I don't have to kill myself. I thought, well, all right, this is dumb. Guess I don't want to kill myself after all. And so I didn't. And I went back to the doctor.
So you realized it, went back to the doctor, and did you confess?
I did. And I said, well, I don't need to take this much. I'm not as crazy as Aunt. And he said, well, but you're not Aunt. What does that have to do with anything? He actually did this whole thing about, well, of course you're not as crazy as she is. Of course you're not as sick as she is. But everyone's body chemistry is different. And you don't know what drugs affect her versus you, blah, blah, blah. Intelligent doctor. He just went with the explanation that he knew I would accept and get me to swallow more pills.
Well, now hang on a second. You're saying it like he lied to you. That is the reality.
Yeah.
Not every single person with anything takes the same. For example, I'm a 6'3", 250-pound man. When I get a headache, I take 2 regular Tylenol, boom, headache is gone. My wife is a 140-pound, 5'4" woman. When she gets a headache, she takes 3 extra strength Tylenol and then she chases it an hour later with more, because that doesn't mean that her headaches are worse than mine, better than mine. Just for whatever reason, my headaches are cleared up by a couple of pills and hers are more difficult.
I know.
Well, but you just made it sound like he tricked you.
No, I don't think he tricked me. I think he knew what argument I would respond to best.
Which was also accurate.
Yeah, because there's 50 arguments and he picked the one that was the best. He could have gone with one of the other 49, which would not have worked as well with me. Like, oh, there's not a moral value to mental illness. That would not have worked to me.
I see exactly what you're saying. So that's really interesting. Let's touch on that for a moment. It was very important to you that you not be seen in the same light as your family member.
Yep, because I wasn't crazy.
Well, but more importantly, your family member was disrespected by other members of the family, and you felt that that was why? Because of her mental health issues?
I don't know.
Because I would challenge that the reason that she was disrespected by other members of the family probably didn't have anything to do with her mental health, but rather, well, her behavior, which I suppose you can argue is mental health. But the point is that you had decided instantly that the reason that she was not held in high esteem by other members of the family is because, she has mental illness. Whereas it's certainly possible that the reason that you would still be held in high esteem is because you were a physics student, you had a full ride scholarship, you were a national merit scholar. At this time in your life, you were quite accomplished, but you were afraid.
I don't know that I consciously thought that, and I don't even know that that's accurate. I don't know if that is how my family viewed it.
But that is what entered your mind, and you took, dangerous action on it.
I don't know that that's what entered my mind. I'm not sure that that was my thought process, but I'm not really sure what was.
Well, but wait, I want to nail this down. Your specific thought process was, Lisa is not as crazy as Aunt, therefore I need less pills. That's
right.
What you thought. So
yes.
You were actually putting ethical and moral values on your treatment plan for your health issue.
Yeah, and I spent a long time doing that, feeling that I should be able to do it without the pills, that the pills were a crutch type thing that I had to be able to overcome and not need anymore.
What got you over this line of thinking? Because this wasn't like a one-shot deal, if I understand correctly, right? You kept bucking the system and being smarter than doctors. I'm making air quotes. And
right.
You messed up a lot.
I continued to struggle with this for years, literally years. And I would go on and off the pills, thinking that I was better and I didn't need them. And yeah.
What was the turning point?
I don't know that there was any particular moment. The thing that bothered me the most was the idea that I was destroying my innate personality through drugs. I was heavily indoctrinated with the just say no of the 80s, and I believed it very strongly. So this idea of drugs was uncomfortable to me. And I kept thinking that I was changing myself. I was changing myself with chemistry, and that I didn't want that because after all, I wanted to preserve my own self. And I finally came to the realization that I'm going to die. I'm going to kill myself. I'm going to kill myself. And so I'm worried that I'm erasing my personality or changing myself with these drugs. Well, if I die, that's the ultimate erasure. I will completely change it because it'll be gone. Therefore, any segment of me that is remaining, this is the only way to save it. Better to have some than zero. And if I stop taking these pills, I will have zero because I'll be dead.
This obviously worked.
It did, eventually. It's not necessarily a good argument, I know, but this is what I thought at the time.
It seems wrapped up too perfectly.
Oh, no.
Oh, I just eventually realized it was wrong. Did anything happen? Did you lay in bed for a week? Did somebody bang on your door? Did the police get called? Just like that's usually how this happens. Most people don't wake up one day and think, oh, wow, I got to fix this. Unfortunately, in mental health, usually a crisis happens.
I'm not saying that I woke up one day. I'm saying that I eventually came to this realization over the course of many years.
But how?
Because you're asking me if there's one epiphany moment. No, there wasn't. I just eventually got to this.
For me, there was the epiphany moment, as you know.
But I think that's actually the unusual thing. I think most people do not have that. I actually had a therapist once who said that to me. That's not real life. That's TV. Therapy is not about sudden, amazing breakthroughs. It's about slow, steady progress forward.
Well, no, hang on a second. You didn't mention that you were going to therapy. Did you realize this with the help of a therapist, or did you realize this on your own?
No. I mean, probably. I went to therapy on and off for those years, here and there.
Do you like therapy? Are you a fan of therapy?
I'm not as big of a fan of therapy as I am of medication. I feel that for me personally, the medicine is much more important because I've gone without therapy for long stretches and not died. But whenever I stop taking the pills, I get really, really sick. For me personally, I feel that the meds are the major component.
We'll be back in a minute after we hear from our sponsors.
Interested in learning about psychology and mental health from experts in the field? Give a listen to the Psych Central Podcast, hosted by Gabe. Visit psychcentral.com/show or subscribe to the Psych Central Podcast on your favorite podcast player.
This episode is sponsored by BetterHelp.com. Secure, convenient, and affordable online counseling. All counselors are licensed, accredited professionals. Anything you share is confidential. Schedule secure video or phone sessions, plus chat and text with your therapist whenever you feel it's needed. A month of online therapy often costs less than a single traditional face-to-face session. Go to BetterHelp.com/Psych Central and experience 7 days of free therapy to see if online counseling is right for you. BetterHelp.com/Psych Central.
And we're back talking about my history of mental illness.
Just to clarify for my own edification, you consider the medication to be the major component in your wellness, but you certainly acknowledge that all of these other things contributed.
Of course, yes.
You kind of needed them all to get better.
Maybe. But again, the meds have always been the big thing for me.
I know the meds have been the big thing for you, but I guess I'm curious now, moving on to Lisa Kiner, mental health advocate, how do you feel about things like support groups, online peer support, learning from other patients? Where does that fit in Lisa Kiner's treatment plan?
I haven't done support groups in a long time. I went to a support group not with you, but when we were together, and it was a huge deal. That support group was extremely helpful. That was the first one I'd ever been to. It was super helpful. Like from the very first session or the very first meeting, I was like, oh my God, this place is amazing. And I think I even turned to you and said, oh my God, this group is going to keep us together.
Well,
well, that was many years before we divorced.
Wow. Don't mention that group's name. They do not need the bad publicity.
I have certainly had good experiences with support groups, but it's not something I've actively sought out in many years.
I'm always fascinated by you, Lisa, because you talk about the support group. You're like, oh my God, it was great. It was wonderful. You even said that it was going to save our marriage, and you have very fond memories of it.
Oh, it was great. I went there for like a year.
And then you follow that up with, but yeah, I don't think it was a big part of my recovery at all. Like, I don't really think about it all that much.
No, that's not what I said.
I'm always fascinated how something can go from incredible, but you also see it as very meaningless.
That's not what I said at all.
No, please clarify.
I'm saying that was many years ago, and at the time it was very meaningful to me and helped a lot. But as of right this second, I do not attend a support group, no.
Well, right. So it's not meaningful today, but in the scope of your recovery, it was meaningful.
Probably, yeah. But again, that was many years ago.
I understand what you're saying. I'm not going to a support group now. And at different times in my life, I've gone up to a year without going to a therapist. But I would never, ever describe therapy as not important to my recovery, even if I hadn't been in a year.
I'm not saying it's not important. I'm saying the major point for me was always the drugs.
No, I know. You always get back to that. I get it. I'm trying to figure out what other things you utilize other than medication.
I did do therapy sporadically. I did a couple of support groups. But then, of course, just things in life changed also. Frankly, the number one thing that helped was getting treatment for my sleep disorder.
Well, no, that's very interesting as well. I know we fell down a rabbit hole on the whole medication thing, but the reason that I'm belaboring this point is because there's always these two factions in mental health, right? There's meds good and meds bad. Those seem to be the warring groups, for lack of a better word. So it's fascinating that you essentially fought for both sides. You thought the medication was bad for a while. You wanted to get off of it.
I was
thought
young.
It was a crutch. Sure, I'm not accusing you of doing anything wrong. I'm just saying that you used to be on the meds bad side. And now, every time I ask you a question about what you use other than drugs, you make sure to answer the question by starting off that the prescription medication is more important. That is a fascinating change. It's like switching political parties at this point. It's like you were a hardcore liberal and now you're a hardcore conservative. What made the change? And your answer just seems to be, oh, I don't know.
I don't know what you want. There isn't one big moment of change. I saw the results. Every time I stopped taking them, which was many times, bad things happened. And when I started taking them again, the bad things got better. I don't know what you want. I mean, eventually you have to learn the lesson. Eventually you have enough experience.
Oh, if only that were true.
But as we talked about in other episodes, it's not a cut and dried thing. It's not an easy question in terms of are meds good? Yes, no. Not necessarily. Or maybe yes, not all the time. I don't know. Something like 1 out of every 8 Americans takes an antidepressant. That's crazy. 1 out of 8 people does not need an antidepressant. They are ridiculously overprescribed. But I definitely need it, and I will die without them. How do you say that? How do you say, oh, no, everybody else is the ones who don't need it, but not me. I'm different. I'm special. There's no easy way to say these things.
I see exactly what you're saying, Lisa. Thank you so much for clarifying that. It's a fascinating thing for me. And I very seldom talk to somebody who has been on both sides. As you know, Lisa, I always took my medication. I was never anti-medication. It saved my life as well. So I never had this like anger or animosity or, well, just really anything toward medication, except these very overwhelmingly positive feelings. So I was just very interested in talking to somebody like you who really has been on, quote unquote, both sides of the proverbial aisle.
Because it really does change you. It changed my thoughts. Well, that's creepy because it's this little tiny pill. Really? That can change my thoughts? It starts to make you almost question like reality. How much of our thoughts are us? And it becomes an almost spiritual or existential question because what is thought, right? It gets very, very meta.
I love it when you mention meta. Now,
I know. Because we all want to think that our thoughts are somehow special or are uniquely us. But how unique can they be or how intrinsic to us can they be if swallowing one little tiny pill every day can alter them so dramatically? What does that say about the nature of thought itself? Apparently, it's not intrinsically you. Apparently, it's not hardwired. Apparently, it's not that special if it's so easily changed. Not that it's easy, but seriously, those pills are really small and they have this very big effect. I just struggled with that for a long time. What is the nature of personality and who am I really? And, what's the nature of existence? Because again, it was such a dramatic change in my own thoughts. I guess if it had changed, if I was sniffing and now I'm not sniffing, or I had a rash and the rash went away, I would feel like that was different. Your thoughts are you. Your body is not you. Your thoughts are you. It disturbed me quite a great deal that the essential core me was being altered in this way. And that bothered me. It bothered me for a long time. It's not so much that I'm anti-medication. I'm certainly not anti-medication for anything else. It's that I felt that this was changing me. And it wasn't so much that it was a bad change as it was I didn't like the fact that I could be changed at all. Was I still me? Was I just altering who I was? Was this some sort of sci-fi world? It was very disturbing to me for years. When you say, oh, you were anti-medication, was I? Of course, there's also something to be said for, well, I was anti-medication for me. I thought everybody else should take it. Of course, now I've slipped to, oh no, medication is for me, but most of you people don't really need this crap. Yeah, it's just really complicated, and I don't know how to explain it quickly or neatly.
Lisa, thank you for being so candid. I know that these are tough concepts that people struggle with. I love listening to you because you don't have like this curated view, right? You're just like, look, this is what happened to me. I don't know how I feel about it. This is what I hope that happens to others. It's nebulous, right?
Nebulous is a good word.
It's difficult. And I appreciate you trying to talk it out, knowing full well that you're going to piss somebody off and that somebody else is going to be like, well, she doesn't understand. Like it's real.
Well, I'm not going to get there. I'm not going to be able to get to an easy understanding of this. This is something I've struggled with for literally decades. I'm not going to be able to get to a quick answer on this.
And that's how it worked out in your life. Like, that's the important thing, right? So many times people get angry at the things that people say because they're like, well, that's not true. But let's be 100% upfront. It is 100% true for Lisa.
Yes, definitely.
Lisa, switching gears, you are also an excellent example of somebody that had both mental health problems and physical health problems. And if I understand correctly, addressing the physical health issues contributed greatly to improving your mental health, which is fascinating because, as you know, the whole world sees them as two separate things that apparently don't interact. Talk about that.
I had a lot of physical health problems growing up that I was not adequately treated for. Mostly because we just didn't understand what the options were, didn't understand the treatments. Treatments were a lot different back then. I have a genetic malformation of some of the bones in my face that required quite a lot of maxillofacial surgery as a child. And I also always felt like that was this huge driver to my depression because the pain. And I didn't really recognize it. I did not recognize pain until I was 12. I did not really recognize it for many, many years. But yeah, having physical problems, not feeling well, destroys your mental health. I feel like I was probably predisposed to mental illness anyway. I think no matter what would have happened, I would have had depression, but I'm not sure. And yeah, it's pretty much impossible to have a long-term illness and not become depressed. And then once you are, where do you go with that? I had my final surgery when I was a junior in college. I had an excellent outcome. So changing that environment, changing that aspect of my day-to-day life made a huge difference to my mental health. That helped a lot. And then we've discussed a couple times before, I do have a sleep disorder.
That's what bonds us. That's like our big bond. We're CPAP buddies.
Exactly. I know. So romantic.
We both love sleep hygiene and giant elephant masks on our face.
Well, they're not that giant anymore. They've gotten much smaller just in the past 10 years.
Masks are the same size. So is the tube.
The tube's the same size, but the masks have gotten way smaller. Your mask isn't smaller?
It's not, but that's not the point. The point is that you also had a sleep issue.
I did, which I did not recognize, in part because of the depression. I had gotten to the point where I was sleeping 14 or 16 hours a day, and it never occurred to me that that was a problem. I was not diagnosed with a sleep disorder until I was 25. And the only reason it even happened eventually is because I got really annoyed with my psychiatrist, because I had decided that this was a symptom of my depression. Because he's like, your depression's under good control. I said, look, I'm no longer sad. I don't want to die by suicide. Yes, but I'm sleeping constantly. Depression is not just sadness. It's also all these other things. I am sleeping constantly. And I thought this must be a symptom of depression or a side effect of the meds. And when you're sleeping 14 or 16 hours a day, yeah, there's very few jobs you can hold down, very few relationships you can maintain. There's just not a lot you can do when you have to sleep that much. And it's not like I was well rested the rest of the time. It's not like, oh, for those few hours I was awake, I was bright and alert. No, I was in this fog all the time, which I was convinced was related to my depression. And I eventually got fed up with my psychiatrist. It was like, fix this. What is wrong with you? Fix this. And he said, I think you need to see an expert in sleep. And at the time, I thought, oh, for God's sakes, you are such an ass. Just do your job. Stop pawning me off on other doctors so that you don't have to deal with my problem. And I decided that's okay. I will jump through his hoops, and then I will come back and make him fix this. And of course, I went to see a neurologist, a specialist in sleep disorders, who diagnosed me in like the first 10 minutes. He was like, oh, yeah, you definitely have this. Absolutely. 100% for sure. So I feel a little bad now about the negative thoughts I had towards that psychiatrist. I'm sorry. I should not have had negative in my heart towards you because you saved me. Yeah, it was amazing. We do not give enough credit to sleep in our society. And it also demonstrates that you're used to what you're used to. It didn't occur to me that this was abnormal. It didn't occur to me that that was strange because this is the way it had always been for me.
Lisa, your story has always shown me the importance of treating the whole self, because you had specialists that worked on your physical body. I mean, you had
Yeah, I had a lot of doctors.
Lisa had surgeons. I mean, you had top surgeons in the country paying attention to your physical health. You had top mental health doctors at some of the top. Frankly, you had access to medical care that rivals that of the President of the United States. But the fatal flaw was that mental health and physical health were always treated separately. And it wasn't until they were frankly put together for you that you really made the amazing progress that you have made.
Yeah, it was amazing.
And that your life did, well, frankly, a complete 180. Do you think
it was
that
incredible.
if you continued to look at them as two separate problems, you ever would have improved?
I never looked at it that way, but probably not. It was amazing. It was a complete change. The doctor that has my respect the most was the one that when I came back and said, hey, it turns out I have a sleep disorder, who said, oh my God, I can't believe I missed that. Yeah. But of course, he wasn't the only one. All of my doctors missed it, in part because I was hiding it, but also because, when you meet a young woman, I was in my 20s, I was of a normal weight. They just didn't think it. No one thought I had sleep apnea. No one thought I had narcolepsy. Narcolepsy itself is unusual. Just no one thought about it. I didn't look to them like what a typical presentation should. And yeah, within just a few months of treatment, oh my God. Like, I had honestly, until I was 25, I never once sat through an entire movie without falling asleep. Never once. Never. And that never occurred to me that that was odd. It never occurred to me, I should get that looked at.
Basically, when you were 20, you were my grandma and grandpa.
Pretty much, yeah, yeah. To this day, I will watch a movie that I've already seen, and there will be a section I'm like, I don't remember that. And then it occurs to me, oh my God, this is where I fell asleep. I also wonder, again, because I was so incredibly depressed in high school, I was also sleeping constantly. I fell asleep in every class, every day. And again, I had perfect grades. Oh, she's young, she's otherwise healthy. I get why no one thought I had a sleep disorder. But why did no one wonder? Why did no one think to themselves, gee, what is this kid's home life like? Now, my home life was perfectly fine. There were no problems there. But how come no teacher ever said, my God, why is this girl coming to school every single day exhausted? What is going on with this kid? Again, if you have good grades, people think everything must be fine.
Lisa, as you know, I've always looked up to you when it comes to understanding mental illness, mental health. You were my peer supporter before I knew what peer support was because you had been there. I am positive that the reason that I never messed up with medication, which statistically is very unusual for someone with bipolar disorder,
it is
because you messed up first and told me all about it and really convinced me both with, threats and actual data and information that it would be in my best interest to follow my treatment plan as prescribed and not think that I was smarter. I know that you had a long road to getting well, but it worked out really well for me.
You're welcome. I did it all for you, Gabe.
Everything you do, I do it for Gabe's mental health. Lisa, Thank you so much for opening up on the podcast. We really, really, really appreciate it. Do you have any final words for our listeners?
Put me on the spot. I think I would have had mental illness regardless. It certainly runs in my family, and it certainly seems to be part of my personality. But changing other things, changing your environment, changing the other things that are going on in your life obviously has an impact on your mental illness, and improving your physical health, getting yourself so that you can stay awake for an entire movie. Yeah, it really improves your mood. Like a lot. Like you wouldn't believe.
Lisa, it's always fun to put you on the spot, and it's always fun to interview you. Thank you for being so open and honest on the show that you co-host.
I'm struggling with it. I'm not really into introspection or revealing anything about myself, which once again makes this the perfect job for me.
You make bad decisions. I am living proof of that. All right, everybody. My name is Gabe Howard, and I am the author of Mental Illness is an Asshole and Other Observations. And for the next 2 weeks from the date of this podcast, if you go to gabehoward.com/merchandise and order the book, and in the notes put a t-shirt size, I will mail you a free t-shirt. And that is addition to all the other Not Crazy Podcast swag that you will get, as well as my signature. Limited time offer, gabehoward.com. If you're boring, go to Amazon. No swag, no signature. You will probably pay more.
And we'll see you all next Tuesday. You've been listening to the Not Crazy Podcast from Psych Central. For free mental health resources and online support groups, visit psychcentral.com. Not Crazy's official website is psychcentral.com/notcrazy. To work with Gabe, go to gabehoward.com. Want to see Gabe and me in person? Not Crazy travels well. Have us record an episode live at your next event. Email show@psychcentral.com for details. Okay, it's the no phone time.
Ooh.
See, my phone is turned off and over there. I can't even see the screen from here.
Hang on, Kendall sent me a picture. Oh my God.
Okay, we're still recording.
Oh, yeah, you're right.
Yeah, so you can play with your phone when we're done recording. Is there anything else you need to record?
I'm looking.
Okay, that's not what you're looking at. You're looking at something else.
I could be looking at porn, you don't know. All right, ready? On the count of 3.
Brag that up.